Imagine feeling very weak and exhausted, so you sleep, and when you awake, you just want to close your eyes. Mouth being extremely dry, noticing you have drunk 6 gallons of water in 48 hours. Not fully understanding what's going on with you, your wife makes you go to the hospital. Well, that was me a few months ago, with a blood glucose of 648. Today, I will inform you about diabetes, the daily terror that is part of my life now. What it is, its causes, symptoms, types, and treatment options. The Mayo Clinic states there is no cure for diabetes, but it can be managed. According to the American Diabetes Association, diabetes is a group of diseases characterized by high blood glucose levels, which most people would say blood sugar levels, the result from defects in the body's ability to produce or use insulin. There are different types of diabetes, including type 1 diabetes and type 2 diabetes. The symptoms of diabetes can vary depending on the type of diabetes. Symptoms can develop gradually or may not show at all. In the United States, approximately 34 million people have diabetes. According to the Centers of Disease Control and Prevention, CDC, of these, about 5 to 10% have type 1 diabetes, and the remaining 90 to 95% have type 2 diabetes. Type 1 diabetes is a chronic condition in which the body's immune system attacks and destroys cells in the pancreas that produce insulin, resulting in insufficient insulin production. Type 2 diabetes is a chronic condition in which the body becomes resistant to insulin or does not produce enough insulin to maintain normal body sugar levels. Diagnosis of the diabetes is typically done through blood tests which measure blood sugar levels. The invention of the first blood glucose meter for home use is attributed to two researchers, Dr. Richard Bernstein and Dr. Arnold Kadish, in the mid-1960s. They both developed methods of measuring blood glucose levels in diabetic patients, which eventually led to the development of the first commercial blood glucose meter. Treatments of diabetes vary, but with medications like metformin, inhibitors, and insulin. Frederick Batten, a Canadian medical researcher and physician, is credited with the discovery of insulin as a treatment for diabetes. In the early 1920s, Batten and his colleague Charles Best conducted experiments in which they removed the pancreatic cells from dogs and found that these cells produce a substance that lowered blood sugar levels. Diabetes is a serious and chronic disease that affects millions of people worldwide and can lead to serious complications if you don't manage them properly. In conclusion, checking your blood sugar is extremely important at least 4 times a day. A quick fact, World Health Organization states that 108 million people in 1980 were diabetic. Today, over 422 people worldwide have diabetes. If you are diabetic, remember to have your blood sugar kits with you, to keep up with your supplies of testing strips and lancets, and do the best you can to maintain and manage your blood sugar levels. In the words of Theodore Roosevelt, speak softly and carry a big stick. You will go far.